Regional Health Directorate has tracked all 48 persons who were on the run after testing positive for COVID-19. The region has so far recorded 1,065 cases with 9 deaths. William EVANS-NKUM is joining us. Mr. NKUM, we lost you earlier. I wanted to find out what the latest is with this development of tracking all the 49 who run.
Well, so currently they are all in isolation, but we are not out of woods yet because the latest information has suppressed that fear of a possible widening of scope as far as spread of the cases is concerned. But when it comes to what the health experts call positive or other contacts that might, or other people that might have come in contact with these 48 people, but not knowing their status, it is also another threat that they would need to address. But what they are also saying is that when it comes to information extraction, I think the people have been cooperative. Talking about the 48 people, they have been cooperative. So that is the good news. But they are still, one would say, searching for more contacts as far as these people are concerned. Steve.
Right. So I want to find out whether the Ghana Health Service, the regional directorate, was able to extract from these 48 the reasons why they bolted.
Stigma. That was the reason. And I think it's something that they've been talking about. A lot of concerns emanating from almost all the administrative districts, especially the two areas that have recorded the highest number of cases, talking about Obuasi Municipal and Obuasi East Districts. And you know, these areas were, the first 8 people who were actually on the run came from these areas. So stigma, they've told the Ghana Health Service, kind of pushed them to go into hiding.
So finally, before you go, I want to get a fair idea of the region-wide situation. I know that with the running away of these 48, there were other measures in place. Now the cases have been rising in the region as well. So generally, overall, from people's behaviors and attitudes in the marketplaces to public transport to where we are now, what's the situation in Ashanti region?
Well, so, Stephen, let me just give you the breakdown, and then we also tell you what the Ghana Health Service is doing to ensure that at least a certain level of, they curtail or manage the increasing number of cases, even though currently it is not too significant because per our last count, the last time we had a conversation, we're hovering around 918 cases. Obuasi Municipal had recorded 386. Now, at 1,065, Obuasi Municipal has recorded 389 cases. Obuasi East, which is second on a tracker, the last time at 918, they had recorded 206. They are now they now have 212 cases. Kumasi Metro has jumped from 83 to 114 cases. Ofori Chrome has also jumped from 49 cases at 918 to 64 at 1,065 cases. Now, interestingly, Ascori Mampong was just 13, and it was not even on the list of the top 5. Now, Ascori Mampong is the 5th on the tracker. From 13, Ascori Mampong has now recorded 48 cases. Achoma Kwauma, which was 5th on the tracker, is now 6th with 37 cases. So at 918, Achoma Kwauma had recorded 30. Now they are 37, so 7 more cases have been added. Now, so if in terms of the total number of cases, I know I've mentioned that, but let me just repeat: 1,065. Deaths, we have recorded 9 deaths. Recoveries, the second repeat negative, and technically that is what you would describe as recoveries. 97, the first repeat negative, they are waiting for another test to confirm their status. We are talking about 230. Total admission, 10. And then cases in isolation, we also have 84. When it comes to female population, as far as COVID-19 cases are concerned, we are talking about 557, representing 52%. And the male population, talking about males that have contracted the disease, we also have 508 in the region, representing 48%. Now, We've also been asking the regional health director whether it is appropriate for the restriction to be eased, but they are saying that modalities will have to be set out for the institution. In fact, they will have to come out with their modalities, not even setting up for them, but they will have to come out with their modalities when it comes to management and also ensuring that members and all of that adhere to the social distancing protocol. Then anybody at all, the authority can consider easing that restriction. Otherwise, it will not be appropriate for the restrictions or the ban on social gathering to be lifted. Then your earlier question that has to do what the region is doing or the Ghana Health Service is doing. I must say that they've intensified education. For instance, if you look at the cases, trend as far as the two hotspots are concerned, I'm talking about Obuasi Municipal and Obuasi East District, you could see that there has been a drop of cases, even though they are recording, but it is not as significant. I'm talking about the numbers are not as significant as what we used to see between 19th and 27th April. So it all boils down to the fact that some education is being intensified on the ground for people to really understand the spread of the virus and how they can also protect themselves against contracting it, Steve.
Right, thank you very much, William EVANS-NKUM, for that update from the Ashanti region. This is still Midday Live from our studios at Adesawe, Kanda and Accra. We're streaming live on Facebook and on 3news.com. We'll be right back with more news. Please stay.